Is this on? Okay. Good afternoon. Welcome to the City of Fairfax. My name is David Meyer. I am the Mayor of the City of Fairfax, and I appreciate your interest and your presence today. In the last 24 hours, the City of Fairfax was informed of its first presumptive positive case of the COVID-19 virus, also known as coronavirus. Today we have several officials who are going to be speaking to this issue, and I would like to begin by recognizing John Silcox from the Fairfax County Health Department.
Thank you, Mayor. I'm John Silcox. I'm the Public Information Officer for the Fairfax County Health Department, and I want to welcome you to today's event. We've assembled a team of public health officials here to provide you a status update on those two presumptive positive cases here in Virginia. You're going to be hearing from representatives of our State Health Department, the Fairfax County Health District, and Prince William Health District. We also have a representative from the Director of the Department of General Services Division of Consolidated Laboratory Services with us. And I would also make time at the end to hear from our Chairman of the Board of Supervisors for Fairfax County, Jeff McKay. So as we go through this, we're going to allow those health officials to give you an update on what's happening at the city, county, and state level with this response. And then we'll open it up for some questions at the end for any of the folks here on stage. I just want to remind you that this media briefing is being live streamed on Fairfax County's and Fairfax City's government channels and the Health Department's Facebook page for those who may be viewing at home. Again, we'll take questions at the end. And now I'd like to introduce our first speaker. I'm honored to introduce our State Health Commissioner, Dr. Norm Oliver.
Good afternoon, everyone. As Mr. Silcox just mentioned, I am Dr. Norman Oliver, the State Health Commissioner in Virginia. Yesterday, the first two cases in Virginia of the novel coronavirus disease, COVID-19, were identified. A coordinated public health response is already underway. While the risk to the general public is low, the Virginia Department of Health is working with the Centers for Disease Control and Prevention, the Fairfax Health District, the Prince William Health District, and our Department of Defense partners to identify people who had contact with the cases and may be at risk of becoming infected with this novel coronavirus. I would like to sincerely thank our partners for collaborating in this very complex and rapidly evolving situation. Before I turn this over to my colleagues to provide more details, I would like to emphasize that protecting the health and well-being of Virginians is our top priority. The virus is spreading much like a novel influenza virus would. VDH, the Department of Health, has led a very robust and comprehensive pandemic influenza preparedness effort since 2004. VDH successfully responded to the H1N1 flu pandemic in 2009 to 2010, and that work serves as a very solid foundation for the work that we're doing in response to COVID-19. The Virginia Department of Health works with partners across all sectors, including healthcare providers, state and local government, first responders, and many community partners to prepare for and respond to outbreaks and all types of emergencies. For more details on this COVID-19 disease and our response to it, I'd now like to turn it over to our state epidemiologist, Dr. Lillian Peek.
Good afternoon, everyone. Testing for the patient at Fort Belvoir was conducted at Walter Reed National Military Medical Center. Testing for the patient from Fairfax City was conducted at the Department of General Services Division of Consolidated Laboratory Services in Richmond, Virginia. Both tests will be confirmed at the Centers for Disease Control and Prevention. Both cases had traveled internationally days before developing symptoms, and the two cases are not related. At this point, there are no signs of the virus spreading in the community in Virginia. As of 9 o'clock this morning, 44 Virginians have been tested for the novel coronavirus. 36 tests were negative, and we are awaiting results on 6 tests. Virginia has been preparing for the possibility of cases occurring in the Commonwealth since early January, when the novel coronavirus was first identified in China. The Virginia Department of Health has been closely coordinating with clinicians, our state lab, and other key partners statewide, so we are able to identify cases early and take action quickly to prevent the spread of the disease to others. Virginia's local health departments across the state are working with their communities to prepare, increase awareness, and encourage prevention. VDH stood up a COVID-19 webpage very early in the response, and we are keeping it up to date with accurate information. A call center is open for people who have questions about COVID-19. The number is 1-877-ASK-VDH3. If someone has respiratory symptoms like fever, cough, and difficulty breathing, and traveled to an area where the virus is spreading, or had contact with a confirmed case, please call your doctor to discuss your symptoms. Dr. Allison Ansher, the District Health Director for Prince William Health District, will now provide information about the case in that district.
Good afternoon. I'm Dr. Ansher. I'm the Health Director for the Prince William Health District, which includes Prince William County, Manassas City, and Manassas Park. As the others have mentioned, there have been 2 presumptive positive cases of COVID-19. The Prince William Health District is coordinating its response with the Virginia Department of Health, Governor Northam's administration, and the Centers of Disease Control. The Virginia Department of Health and the Prince William Health District are supporting the public health entities of the Department of Defense. We are working on the contact investigation in our district for those who are not on Marine Base Corps Quantico, and we will be coordinating with the other jurisdictions which may have some contacts to that case. Most importantly, we have exercised previously with Marine Base Corps Quantico in the past for various public health events, in particular for H1N1 response. So we feel that we have a nice coordinated relationship with the Marine Corps base and are prepared to help them respond. We are working around the clock, as you can see from the bags under my eyes, as the public health issue continues to develop and we learn more. The Prince William Health District is working on taking all measures, of course, to protect the health of the residents of not only our community, but of the state of Virginia. Finally, despite these 2 major developments, there are 2 action steps Virginia can do during this time. Taking simple precautionary measures to prevent the spread of this virus through their community, and relying on the VDH and CDC website for the most accurate information. Next is Dr. Gloria Adiensu. She's the Fairfax County Health Director, and she will provide information on what's happening in Fairfax right now.
Thank you, Dr. Ansher. Good afternoon. I'm Gloria Adiensu, Director of Health for Fairfax County. The Fairfax Health Department serves the Fairfax Health District, which is comprised of Fairfax County and the cities of Fairfax and Falls Church. As Dr. Oliver stated earlier, a Fairfax Health District resident has tested positive for COVID-19 through testing conducted at Virginia's Public Health Lab, DCLS. Again, this is a presumptive positive result, which means that the CDC will be confirming the test results. The individual is a Fairfax City resident. And while we await confirmation of the test result, we are taking public health actions and are working closely with our city, county, and state partners to monitor the patient and identify any close contacts who may have been exposed, and would require testing or monitoring for symptoms of COVID-14. Fortunately, the individual had limited contact with others while ill, and therefore the risk to the general Fairfax community remains low. Next, Dr. Ben Schwartz, who is a medical epidemiologist and Director of Population Health and Epidemiology at the Fairfax County Health Department, will provide specifics about the case.
Good afternoon. I'm Dr. Benjamin Schwartz. I'm the Director of Epidemiology and Population Health at Fairfax County Health Department. The individual from Fairfax City who became ill is a traveler in their 80s who had traveled on a Nile River cruise, similar to other positive COVID-19 patients that have been identified elsewhere in the United States. The patient developed symptoms of respiratory illness on February 28th and was hospitalized on March 5th with symptoms of fever, cough, fatigue, and shortness of breath. After test results for common respiratory pathogens like influenza were negative, specimens were collected and sent to the Virginia State Laboratory for testing, and the testing came back as a presumptive positive for the virus that causes COVID-19 on March 6th. The individual remains hospitalized and is in stable condition. As Dr. Adeoyensu stated, the Health Department is working with the Virginia Department of Health and Fairfax City to identify any close contacts of this resident who might have been exposed. If other people are found to have been exposed, we will provide guidance to those individuals and will monitor them closely for the development of symptoms. We are working diligently and taking all measures to protect the health and safety of our residents. Out of respect for the privacy of the patient and their household, this is the only information we will be able to share about the case. I would like the public to know that no additional precautions are recommended at this time beyond the simple daily measures that everyone should always take to prevent the spread of influenza and other respiratory illnesses, to stop the spread of germs. These precautions include washing your hands thoroughly with soap and water for 20 seconds, covering coughs and sneezes, staying away from others who are sick, and if you yourself are sick, staying home and away from other people until you are well. This is a rapidly evolving situation, and information is being shared as it is known on the CDC, Virginia Department of Health, and Fairfax County Health Department websites. Thank you.
Next, we'll hear from the chairman of the Fairfax County Board of Supervisors, Jeff McKay.
Thank you, Dr. Gloria, and good afternoon, everyone. And I want to also thank all of you for coming out to attend and to help us in messaging with the community. I also want to thank the mayor, the folks from the city council who are here, and acknowledge a few other folks in the audience who are here as well. Our superintendent of public schools, Dr. Brabrand, and the chairman of our Fairfax County Public School Board, Karen Corbett Sanders. Thank you all for being here as well. Just a few things I want to touch on. First, while this is obviously a very important evolving situation, I am imploring the public to come to Fairfax County as a trusted source of information, that there is a lot of misinformation out there, and frankly, we need to make sure people go to trusted sources to get information about this evolving situation. The second thing is that Fairfax County has in place plans for exactly this type of situation. As you might expect, we're a well-resourced county, and we have sophisticated plans to deal with this type of epidemic in place that have been in place for over a decade. And so we are ready to deal with whatever comes our way, and we want to make sure the public has that confidence. And lastly, and probably most important, is that no one should panic. As has been stated before, if folks adhere to the basic daily guidelines that have been mentioned before, the good hygiene recommendations, that is the number one thing we need from the public at this point, to adhere to those things and to not panic as this situation evolves. We will constantly message out to the community updated information, and we hope that everyone in the community helps us by making sure that they are spreading the proper information and following the advice that has been given today. So thank you.
Thank you, Chairman McKay. We're going to go ahead and open up to questions. Before we do, just a couple of quick reminders. As you heard from Dr. Schwartz, we are not providing any additional case details to ensure patient confidentiality, but we do have a number of experts, as you heard from here, who can speak to the actions that we're taking to respond to these cases and what we're asking our community to do. Also want to remind you that this full media briefing is continuing to be available on the Fairfax County Government channel and the City of Fairfax Government channel, as well as the Health Department's Facebook page. There are folks around with microphones, so if you have a question, if you could raise your hand and we'll take your question on the microphone so everyone can hear. And I also want to mention that we have another distinguished guest on the stage with us, Dr. Denise Toney, who is the Director of the Department of General Services, Division of Consolidated Laboratory Services that you heard from, that is doing the testing in Virginia. So if you have questions related to lab testing and those processes, she's also available to answer those questions. So with that, I'll take the first question.
Hi, Rebecca Tan from the Washington Post. Question for anyone on stage who's able to answer, really. Did either of these two individuals interact with large groups of people between the time they were showing symptoms and the time that they were quarantined? Did they come into contact with school-age children or with the elderly?
In terms of our Fairfax City resident, the number of contacts that they had is very limited. We are currently investigating those contacts in the locations where significant exposure may have occurred and therefore where the virus may have been transmitted. But the number is limited, and we are reaching out to each of those contacts, finding out more information about the exposure, and then we will provide guidance to them based on that exposure. We are currently investigating whether there was any exposure. There was no exposure of school-age children in the community that we know of, and we are currently investigating the exposures that they may have had in the healthcare setting.
Hello, my name is Chang Lee. I'm a reporter from the Korea Times. I'm a little bit late, so I didn't hear the information. I want to know where the patient is now located, how he is taken care of, and then people want to know, some people thinking about whether, Fairfax County school thinking about the online education or not. Thank you.
At this point, we are not releasing the name of the hospital where the patient is located because of his privacy and confidentiality. What we can say is that the patient is in stable condition and is not in intensive care.
Next question back here.
Hey, Jess Arnold with WUSA 9. I have two questions for you. First one here, you mentioned a Nile River cruise, similar to the other one we heard. This is not the same cruise, I just want to clarify. And also, have you been in contact with other people who were on that cruise? Do you know if anyone else from the area was also on that cruise?
To our knowledge, it is a different boat than the one that several of the other cases had been on. We don't know a lot of details about this cruise or other potential ill people who had been on this particular boat at that time.
It's lightweight. Have you weighed it? What's the overall weight? Can you explain me a little bit more what you mean with
Sure.
lightweight?
How many pounds, ounces have you weighed the device? 1 to 2
Well,
pounds.
we don't really know, but we only have tried with wet clothes.
Okay. How long is the device?
Oh, we also don't know that. We
Okay,
just
that's
use
okay.
normal PVC.
That's
pipe.
okay. Jump in whenever you want to, ladies.
Right. With the mechanism, do you need to keep your weight on the end of it to keep the claw closed? So is it opened and closed
Yeah.
based on where your arm is?
Yes, because if you close it, then it will.
It's on 2/14 and returned to the United States on 2/17. Again, this is an instance, we believe, of travel-associated COVID infection, not locally transmitted.
Again, on the Marine, did he return home to the base before before receiving care in Fort Belvoir? And secondly, within Fort Belvoir, has he been moved anywhere, or has he been in a medical facility?
To be honest with you, I can't comment on his care at Fort Belvoir. This is a Department of Defense individual. We are the supporting agency. He did come home and did not report symptoms until he was home a couple days.
Okay, so he returned to the U.S. on February 17th, and when was he hospitalized?
He was hospitalized a couple days ago.
Would you be able to provide the date, or?
I don't know the date offhand, exact date offhand.
And just to make sure that I'm completely clear on this, any interaction with the elderly or with school-age children?
We're working on the contact investigation. We had to, the Department of Defense interviewed the individual last evening and has begun to provide us information on contacts. And as you may not be aware, as you start interviewing contacts, sometimes you find out information about other contacts.
Question in the back.
Valerie Bonk, WTOP News. I have two questions. One is information for travelers coming in to airports. Is there something that they should do? Should they self-quarantine if they're coming back from Italy or a cruise of some sort?
So the CDC is monitoring the situation globally, and they have set up a website, or on their website for COVID-19, they're issuing travel alerts. And so you can go to their website to get specific information. It depends on whether the patient or the traveler is returning from a country that has a level 3 travel alert versus a level 2 travel alert. There are specific recommendations, and those countries are changing. So I think the best thing to do is to go to the website and get the most current information.
Great. And my other question is, people who are panicking, what should people do to avoid infection? What should they actively be doing right now?
So the most important thing right now in Virginia, because we do not have any signs of COVID-19 spreading in our communities here, is to stay tuned to what's going on. Make sure that you have accurate information. There is a lot of misinformation out there, so get your information from a trusted site with accurate information like VDH, CDC, or Fairfax County. So that's most critical. Just keep up to date with what's going on. And as we've said, there are simple measures that you can take to prevent the spread of respiratory diseases, including COVID-19, and that's hand washing, making sure that you're covering your cough, staying home if you're sick.
We'll entertain a couple more questions, so I have one here.
Chang again from the Korea Times. Actually, my second question was not answered. A lot of kids now attending, public school. As I remember, around 200,000 kids, attending, and then their parents are very much worrying about what happened the last weekend. The Marine soldier, and then this, the person from the Nile travel. So this morning I talked with some parents. They told me about maybe Fairfax County School, might be thinking about the online education because now that's what's happening in Korea. Now parents, they do not want to send their kids to the schools. And then I have a question directly, Chairman Jeff McKay, how are you going to respond to this, what's happening right now? Thank you.
Yeah, so good question, and as I mentioned before, our Superintendent of Public Schools is here. I think at this point in time, the message is very consistent with what we've already heard, which is if your child is having any symptoms or is ill, don't send them to school. The basic things, the basic guidelines, hand washing, those things are good advice, particularly for young people that we say all the time. But at this point in time, there's no reason for the schools to close schools, and if there is eventually that possibility, then that will be something that will be decided by the Fairfax County Public Schools Superintendent, and it'll be based on information that they receive that concerns them enough to do that. But at this point in time, there's absolutely no reason to do that. I will also say that the schools are very closely monitoring the situation, and I would encourage all parents, and as a parent myself, I've made sure that I've done this, encourage all parents to sign up for communications from FCPS directly. They've been messaging out critical information to the community the last several days. Folks should sign up to get their emails, to get the information that comes out from FCPS, because they are constantly communicating with the community on that.
One more question up here.
Sorry for the many questions. I'm wondering if someone could confirm the name of the cruise that the individual was on. There are several sort of different reports of different cruises. There were 3 individuals in Maryland who were also on a cruise on the River Nile. So really just trying to be as specific as possible here.
So I think the information we provide is as specific as we can be at this point in time. We do need to balance the need to protect the patient's confidentiality as well as determine if additional information warrants releasing more information based on the contact investigation, then we would do so. But at this point in time, the information that we've released is all we would provide at this point. We'll take one more question. Yes.
Fairfax connection. Can you say at all whether the Fairfax City resident is a male or a female?
So I think we identified that person as male, but we are trying to limit information about that individual because obviously we do want to protect patient confidentiality, and we're trying to do that in accordance with how other public health departments are handling these case investigations. So this will be the final question. Thank you.
How many test kits does the state of Virginia currently have? Are more on the way, and does it have enough supplies at the moment?
Thank you for your question. Again, I'm Dr. Denise Tony. I'm the director of the Department of General Services Division of Consolidated Laboratory Services. Currently, we have 2 test kits in-house, and we have kits already ordered and en route. Hopefully, we will be receiving them next week. We are estimating that each kit can test approximately 150 to 200 patients. The number of patients that is tested depends on the number of specimen types that are submitted and also if repeat testing needs to be done. So that number is a fluid number, but that's a good ballpark range. Correct. We have more kits on order, and the availability of kits will dictate how many kits we will be able to receive at one time. Currently, we have adequate capacity to test all the specimens or all the patients that we are currently receiving. So we do have the capacity to handle the volume now. We have been working closely with the Virginia Department of Health as well as our university hospitals and private commercial laboratories to discuss their testing capacity, and we anticipate that the access to testing will continue to increase each day, so that Virginia will have capacity to test whoever needs to be tested.
So with that, I'd like to turn it over to Mayor David Meyer to close us out. Thank you.
I want to thank all of you for being here today. This is a very serious health crisis, but I hope that by the conversation that has ensued this afternoon, all of you will have the confidence that the risks to our general population is extremely low at this time, and that the sources of accurate information are robust, and they're being updated daily, if not more frequently. And I encourage all residents to avail themselves of those sources of information and to follow the best practices that we've discussed. With that, I want to thank my colleagues from Richmond and from the Fairfax County for being here. I hope that their presence today will give you confidence that your leadership, and especially the professionals in the state and local government, are on top of this situation. So thank you very much for your presence today and for all of you being here.